In this lecture, we will review the topic of physical development in adolescence. Although some of the physical changes that happen during adolescence are internal and not visible, others can be seen easily by others. These obvious changes in the body can affect how adults and peers of all sexes view and treat young people. The changes that occur both inside and outside the body during adolescence happen through a process called puberty. This process stems from the release of certain hormones, which are chemicals in the brain. These hormones released are the same in all adolescents, but differences in hormone levels lead to different results in both males and females. The physical changes in adolescence shift them from their childhood bodies to their adult bodies and give them the ability to get pregnant or cause pregnancy. This ability to get pregnant or cause pregnancy is called fertility. Now, let's review a few definitions that you need to know. First, adolescence. The developmental transition between childhood and adulthood, entailing major physical, cognitive, and psychosocial changes. Next, puberty. The process by which a person attains sexual maturity and the ability to reproduce. Next, primary sex characteristics. Organs directly related to reproduction, which enlarge and mature during adolescence. Next, secondary sex characteristics. The physiological signs of sexual maturation, such as breast development and growth of body hair that do not involve the sex organs. And next, adolescent growth spurt, a sharp increase in height and weight that precedes sexual maturation. Now, puberty is the period of rapid growth and sexual development that begins in adolescence and starts at some point between ages 8 and 14. While the sequence of physical changes in puberty is predictable, the onset and pace of puberty vary widely. Now, every person's individual timetable for puberty is different and is primarily influenced by hereditary. However, environmental factors such as diet and exercise also exert some influence. Adolescence has evolved historically, with evidence indicating that this stage is lengthening as individuals start puberty earlier and earlier and transition into adulthood later than in the past. Adolescence has evolved historically. Puberty today begins on average at about 10 to 11 years for girls and 11 to 12 years for boys. This average age of onset has decreased gradually over time since the 19th century by 3 to 4 months per decade, which has been attributed to a range of factors, including better nutrition, obesity, and other environmental factors. And I should note that we are seeing cases of puberty starting earlier and earlier, of girls as young as 7 years old starting their periods. Completion of formal education, financial independence from parents, marriage, and parenthood have all been markers of the end of adolescence and the beginning of adulthood. And all of these transitions happen on average later now than ever before. In fact, the prolonging of adolescence has prompted the introduction of a new developmental period called the emergent adulthood that captures these developmental changes out of adolescence and into adulthood, occurring from approximately about 18 years to 29 years old. I will have a full lecture on the emergent adult. Now, during puberty, primary and secondary sex characteristics develop and mature. Primary sex characteristics are organs specifically needed for reproduction, like the uterus and ovaries in females and testes in males. Secondary sex characteristics are physical signs of sexual maturation that do not directly involve sex organs, such as developmental of breast and hips in girls, and development of facial hair and the deepening voice in boys. Both sexes experience development of pubic and underarm hair, as well as increased development of sweat glands. The male and female gonads are activated by the surge of the hormones, which puts them into a state of rapid growth and development. The testes primarily release testosterone and the ovaries release estrogen. The production of these hormones increases gradually until sexual maturation is met. For girls, observable changes begin with nipple growth and pubic hair. Then the body increases in height and fat forms, particularly in the breast and hips. The first menstrual period is followed by more growth, which is usually completed by 4 years after the first menstrual period. For boys, the usual sequence is growth of the testes, initial pubic hair growth, growth of the penis, first ejaculation of seminal fluid, appearance of facial hair, a peak growth spurt, deepening of the voice, and final pubic hair growth. Now let's review physical growth of what we call the growth spurt. During puberty, both sexes experience a rapid increase in height and weight, referred to as a growth spurt. Over about 2 to 3 years, resulting from the simultaneous release of growth hormones, thyroid hormones, and androgens. Now, male experience their growth spurt about 2 years later than females. For girls, the growth spurt begins between 8 and 13 years old, with adult height reached between 10 and 16 years old. For boys, they begin their growth spurts slightly later, usually between 10 and 16 years old, and reach their adult height between 13 and 17 years old. Both nature, which refers to genes and biological influences, and nurture, which refers to nutrition, medications, and medical conditions, in other words, environmental influences, can influence both height and weight. Before puberty, there are nearly no differences between male and female in the distribution of fat and muscle. During puberty, males grow muscle much faster than females, and females experience a higher increase in body fat, and bones become harder and more brittle. And adolescents' heart and lungs increase in both size and capacity during puberty. These changes continue to increase strength and tolerance for exercise. Now let's review some reactions towards puberty and physical development. The accelerated growth in different body parts happens at different times, but for all adolescents, it has a fairly regular sequence. The first places to growth are the extremities, like head, hands and feet, followed by the arms and legs, and later the torso and shoulders. This non-uniform growth is one reason why an adolescent body may seem out of proportion. Additionally, because rates of physical development vary widely among teenagers, puberty can be a source of pride or embarrassment. Most adolescents want nothing more than to fit in and not to be distinguished from their peers in any way, shape, or form, that is. So when a child develops early or later than his or her peers, there can be long-lasting effects on mental health. Simply put, beginning puberty early than peers presents great challenges, particularly for girls. The picture of early developing boys isn't as clear, but evidence suggests that they too eventually might suffer ill effects from maturing ahead of their peers. The biggest challenges for boys, however, seem to be more related to late development. Now, early maturing boys tend to be stronger, taller, and more athletic than their later maturing peers. They are usually more popular, more confident, and independent. But they are also at greater risk for substance abuse and early sexual activity. Additionally, more recent research found that early maturing boys initially had lower levels of depression than later maturing boys. Over time, they showed signs of increased anxiety, negative self-image, and interpersonal stress. Early maturing girls may be teased or overly admired, which can cause them to feel self-conscious about their developing bodies. These girls are at risk of a range of psychosocial problems, including depression, substance use, and early sexual behavior. These girls are also at risk for eating disorders. Now, late blooming boys and girls, well, they develop more slowly than their peers, as we know. They may feel self-conscious about their lack of physical development. Negative feelings are particularly a problem for late maturing boys who are at higher risk for depression and conflict with parents, and more likely to be bullied. Again, although some of the physical changes that happen during adolescence are internal and not visible, others can be seen easily by others. These obvious changes in the body can affect how adults and peers of all sexes view and treat young people.